So in this video we're going to be doing our upper cervical differentiation assessment. So Kevin, with this test, or with this assessment, I'm going to be looking for any sort of reproduction of symptoms that you came in with regarding your headaches. So when I push on these 6 different spots, it'll be 3 on your left side and 3 on your right side. When I push on these spots, let me know if you feel any reproduction of those symptoms. And if you do, if they're about the same as when you came in or if they're even worse than when you came in. Some spots you might not feel anything, and that's okay, maybe just the pressure from my thumbs. But for this test, we're going to be looking at C01, C12, and then C23. And with this, we're going to be looking for the pain, range, resistance, and then any sort of symptom modification that they might have. And then they're indicated if they come in with presenting with something that looks like cervicogenic headaches. And then with all this, I'm going to be comparing bilaterally. So first of all, I'm going to start with C01. So I'm just going to be coming in here, Kevin. So finding the base of the occiput and then just sliding down. And then we're going to use my ring finger as a marker and just coming on one side, doing the uninvolved side first. And I'm going to layer my thumbs on top on the articulator. I'm going to be pressing towards the ipsilateral eye, looking for that R1. How does that feel, Kevin?
You're good.
Good. And then coming down for R2. About there. And how'd that feel, Kevin?
I just felt the pressure from your thumb.
Okay, good. And then I would compare the other side, his involved side, so I do the same thing. But we're going to move on to C23. So for this one, still having the head and neck in the same position, but I'm going to be finding spinous process of C2 and coming off of it to that articular pillar again. And this time I'm going to be pressing just straight down towards the floor, looking for that R1 again. Is that okay, Kevin?
Yep.
Good. And then coming down, looking for R2 right about there. How about that, Kevin?
Good, just the pressure again.
Okay, good. And then so staying on that same level, we're going to be assessing C12 now. So finding that spinous process, coming off to the articular pillar, and then I'm going to rotate them about 30 degrees to the same side. And this time with the pressure, I'm going to be pushing towards the mouth. And that rotation is going to take up all the slack in that C12 there where the rotation is going to be at. And we're going to be able to isolate C12. So I'm looking for that R1 again. Good, Kevin?
Yep.
Good. And then coming down tight to that R2. How about that?
Good, just the pressure again.
Okay, cool. And then I would compare bilaterally, and that's it for that one. In this video, we're going to be doing our CT junction manipulation. So Kevin, with this technique, it's going to be a fairly rapid movement, but it's just going to be a low amplitude. So not a whole lot of movement being done, just kind of quick and short. With this though, you shouldn't feel any sort of pain. You might feel a little bit of a pop, kind of like when you're cracking your knuckles or anything like that. But ideally, we're going to be doing this to increase the mobility in your neck. How does that sound?
Sounds good.
Okay. And then this technique is indicated if you have limited active range of motion and passive range of motion in the neck, and any sort of hypomobility with joint testing. So we'll start with flexing the head and retracting a little bit, and then I'm going to side bend towards the side until it moves. There. Now we're going to rotate just a little. Hold them there, and I'm going to come up and block out the T1 spinous process of T1. Fine tune. Then we'll do the other side. Retract. got one. Come in again. There we go.